SPARSH at 20 is a significant milestone as such. As I lived 19 years in this hospital, I have seen this vision of Dr. Sharan Patil getting transformed into excellency, which has served the thousands and lakhs of people in a meaningful way. SPARSH not only involves cutting-edge technology, but also it adds a human touch. With this, the patient can recover fast with advanced technology, and emotionally they can heal faster with a human touch. That's why SPARSH is unique. As a joint replacement surgeon, especially the robotic joint replacement surgeon, I would like to involve and inculcate the newer technologies like robotics into more personalized, accurate, reliable and relatable outcomes for the patient suffering with arthritis. And also, I want to give a meaningful, personalized arthritic solution to all the patients suffering with arthritis. We have done more than 1,500 joint replacement surgeries done through robotics. My future vision is to inculcate each and every aspect of joint replacement surgery. It may be from the daycare surgery to the advanced robotic joint replacement surgery, also the post-operative pain management and also the post-operative rehabilitation is my future look to make the patient recover well and or in an organized way. Our innovations are powered by faith in progress, hope for faster recovery, love for restoring the movement and dignity for our patients.